topic of medical debt is coming front and center after the death of actor James Van Der Beek sparked a crowdsourcing campaign to pay his medical bills. Lee Waldman is live in New York City. Lee, good to see you. How significant is the medical debt issue?
Annie, it's good to be with you. Nationwide, 100 million people are dealing with some kind of healthcare related debt. That's according to KFF, a nonpartisan nonprofit organization. It's forcing some Americans to make tough decisions, get the care that they need, or forego it to save money.
We found that the majority of Americans, both Republicans and Democrats, have identified the high cost of healthcare as a very important issue for them. In a lot of cases, actually the top issue.
The rising cost of healthcare is top of mind for many Americans. President Donald Trump spent a few minutes of his State of the Union speech addressing it.
I want to stop all payments to big insurance companies and instead give that money directly to the people so they can buy their own health care, which will be better health care at a much lower cost.
Millions of Americans may be paying more for insurance coverage in 2026 after the Affordable Care Act's enhanced premium subsidies ended in 2025. Dr. Lynn Cotter, a senior researcher with KFF, says people will be forced to make tough choices.
Hard decisions about how to spend their hard-earned money, and it doesn't always end up with them going with medical care.
As healthcare costs rise, more Americans are accruing debt associated with it. 41% of adults are saddled with medical bills they cannot pay, according to KFF's most recent available data. The issue came front and center with the recent death of actor James Van Der Beek. Fans have raised more than $2.7 million to help care for his family and pay off medical debt associated with his cancer battle. Cotter says many who are facing cancer battles are looking to crowdsourcing for help.
I think their healthcare is expensive and there isn't an easy solution.
This year, the Trump administration is calling on Congress to enact the Great Health Care Plan, which it says will lower drug prices, insurance premiums, and increase price transparency. But this plan doesn't lay out specifics on how it will get all of these things done. Annie?
Lee, are states stepping up to help with the issue of medical debt?
Well, Annie, some states are. Just recently, the governor of Illinois forgave $1.1 billion worth of medical debt for people who live there. A handful of other states have done the same. Here in New York City, a program was launched to forgive medical debt locally, billions of dollars worth of it. Back during COVID times, some states use those COVID dollars to do the same, but the experts that we spoke to at KFF say this is just a Band-Aid to a wider issue.
All right, Lee Waldman, we appreciate your report. Thank you.